In 1948, Britain made an extraordinary promise to its people. If you were sick, you would be treated for free. It didn't matter how rich or poor you were or what you did for a living. The world watched as the National Health Service rapidly became one of the most admired models on Earth. From birth to old age, a person's medical needs were fully covered. The NHS was built on a single powerful premise: medical care is a human right, not a luxury. Today, millions of people across Britain are trapped on waiting lists. Emergency departments are struggling with massive bottlenecks, leaving patients waiting hours before receiving basic care. Even critical frontline responses are lagging. Ambulances called for serious emergencies are frequently delayed, lined up outside facilities that are unable to take in new arrivals. Routine surgery targets, like the famous 18-week benchmark, have consistently been missed for years. Cancer patients are frequently waiting longer than recommended for their treatment to even begin. A system designed to eliminate barriers to care has become an endless waiting game. How did we get here? This chart reveals a decades-long trend. As Britain's population grew older and medical treatments became more expensive, patient demand climbed upward. Then came the 2010s. Successive governments instituted strict funding cuts during austerity, starving the healthcare system of the capital needed to keep pace. Hospitals stretched their resources, bed capacity declined, and the system faced escalating staff shortages across almost every department. Healthcare professionals and the public pushed back hard against these budget constraints as the damage became visible on the ward floor. By the end of the decade, the NHS had zero operational slack left to absorb a major crisis. Then, a system already running at maximum capacity was hit by the largest medical emergency in a century. Millions of routine screenings, operations, and appointments were canceled or delayed to make room for infected patients. The backlog exploded. As public wait times stretched into months and years, working families quietly began paying out of pocket for private care, simply to bypass the delays. This directly challenges the founding promise of 1948. Wealth is once again dictating the speed and quality of medical attention. Britain is drifting toward a two-tier reality: one fast lane for those who can pay, and a broken path for everyone else. Behind the statistics are individuals whose lives are entirely paused. Elderly patients languish in beds, waiting months for debilitating surgical delays. Young people are struggling to access critical mental health support during the most vulnerable windows of their lives. And the workforce is exhausted. Dedicated doctors, nurses, and paramedics are being pushed past their limits, driving many to leave the profession entirely. The strain on the system translates into profound human suffering. Recovery efforts are underway, new treatment centers are being built, and aggressive national staffing recruitment plans have been launched. Even with record levels of care being delivered right now, clearing the backlog will take years of agonizingly slow progress. The NHS has survived wars, economic crashes, and massive societal shifts. The public clearly values the institution. The question is whether the system can adapt fast enough to the modern world before its promise of true equality is lost.